Today our topic of discussion is immunity and hypersensitivity. Previously it was said that hypersensitivity was topic, but due to some shortage of time span, the immunity, the basic concepts of immunity, the classification has been incorporated in today's class schedule. So first we will go through the basic classification of immunity. What are innate immunity, what are acquired immunity, what are active immunity, what are passive immunity. I will tell you in brief. Then we will jump to hypersensitivity, the hypersensitivity types with examples. Okay. So both are very important in terms of theory papers. Okay. One question from hypersensitivity has already came into your internal assessment. Type 3 hypersensitivity probably. Very few students have attempted this. Okay. So now starting. So our objectives today to know the difference between immunity and hypersensitivity, to know the different types of hypersensitivity, and to know the mechanisms involved in hypersensitivity with examples. So introduction, what is immunity? Immunity is a protective process, helps body to overcome infection, specific responses to antigens. Okay, there are innumerous number of antigens present all over the environment. So few mechanisms in our body, those are specifically directed to specific antigens, and few mechanisms, those are directed grossly, or those have generalized effect to neutralize those antigen or to combat those antigenic effect in our body. So immune response sometimes is injurious to host. So immunity is important. Okay, immune reaction, the formation of antibody, recognition and killing of the antigen is important, but sometimes the response of antibody or the antigenic stimulation and the antigen-antibody reaction that overcomes and exceeds the need of the body. And sometimes as a result of these unput downable antigen-antibody responses, the host antigen or host body tissue described as an antigen to the antibody present in our body. Those are called autoimmunity. Okay, autoimmunity means immunity, immunogenic reaction or antibody, those are directed against self body antigen, self or host tissue. So a damage to the host mediated by pre-existing immunity to self or foreign antigen. Okay. Next, so classification of immunity. There are various types to classify the immunity, but the basic concept is, one is innate immunity or inborn immunity, another is acquired immunity. Innate immunity or inborn immunity is also called as non-specific immunity because those are generalized effects and generalized weapons to combat the antigen. So innate or non-specific or natural goes to one side, and another side that is more important, more specific, that is acquired. Okay, that is specific. So what are the components of innate immunity? Innate or non-specific or natural immunity has various components like skin, intact mucous membrane, natural killer cell, complement system, okay, reticule endothelial system, okay, phagocytes, reticule endothelial system, NK cell, interferon complement, secretion like containing lysozyme like tear, like saliva, those are present since birth. Okay, and those have generalized effect. Okay, so these are innate or non-specific or natural, and the other part is acquired or specific immunity, and it is sub-classified into humoral immunity and cell-mediated immunity. Humoral immunity, that means the antibody-mediated immunity. Okay, the humoral response or antibody that lies in the serum. Okay, so the humoral immunity is chiefly attributed by the B cells, okay, or the plasma cells. And the plasma cells or B cells, they secrete 5 types of immunoglobulin chiefly: IgG, IgA, IgM, IgD and IgE, okay. And cell mediated immunity is chiefly attributed by T cells, okay, T lymphocytes. One is helper T cell, another is killer T cell. Helper T cell is for the memory function or RAM function, to make a short-lived or long-lived memory of the antigen, and the effector cells or the killer cells or the cytotoxic T cells, they help the cytotoxic T cell to recognize the antigen and act accordingly, okay. Another classification is immunity, innate immunity, acquired immunity. I told you earlier from the previous slide. Innate immunity is also mostly non-specific, okay. Acquired immunity is again subclassified into active immunity and passive immunity. What is the basic difference of active immunity and passive immunity? Active immunity involves cell, okay. The cytotoxic T cell, helper T cell, those are actively recruited for this kind of immunity, that is cell mediated immunity and active immunity. And passive immunity or humoral immunity is chiefly attributed by the immunoglobulins secreted by the plasma cells. So the examples are passive immunity, acquired passive immunity. Those are the natural, that acquired by the vertical transmission from mother to child, okay, through the transplacental migration of maternal immunoglobulin to the fetus's body, okay. So this is passive immunity, but this is natural immunity, okay. But passive immunity and artificial immunity is an example of the immunoglobulin, tetanus toxoid, booster dose, anti-rabies immunoglobulin, okay. So anti-rabies immunoglobulin or IgG, any exogenous immunoglobulin that has been administered to the body for boosting the immunity is called as passive immunity, and it is acquired. Next, active immunity, natural occurrence, is caused by the infection recovery from an actual disease like dengue, okay. Many people, he or she may be infected by dengue virus, and in response to the dengue antigen, okay, dengue antigen, NS1 antigen, that has been widely screened in dengue season in laboratory. So the antibodies IgG, IgM, these are formed against the actual antigen of the disease, is called the naturally occurring active immunity, okay. And artificial is immunization and vaccination. And immunization and vaccination artificial but active. Why? Because artificial, because the immunity is boosted by the exogenous antigen administration by means of live attenuated vaccine, okay. So if live attenuated vaccine are administered to our body, the helper T cell starts to recognize the antigen and starts recruiting the cytotoxic T cell to combat and form an immune meshwork against that antigen. So this is artificially administered but active immunity. Why active? Because cell is involved, T cell is involved. So passive is immunoglobulin is involved or direct the function of antibody, and active immunity is the recruitment of the cell, okay, the cell mediated killing, okay. Clear up everybody? What is acquired immunity? What is natural immunity? What is innate immunity? what is non-specific immunity, what is active immunity, and what is passive immunity, why, how they become natural, how they become artificial. Okay. So these are a schematic diagram shows various components of innate immunity like epithelial barrier, mucous barrier, complement system, NK cells. So these are present, these things are present since birth. Okay, our human system, human reticuloendothelial system or our body have these mechanisms or these cells or these barriers since birth. So these are the components of innate immunity, and adaptive immunity or acquired immunity, they are classified into B cell mediated immunity, that is passive immunity, or antibody mediated immunity, and cell mediated, T cell mediated immunity, that is memory T cell and effector cytotoxic T cell. Those are important for cell mediated immunity, acquired immunity, active immunity. Okay. So these are the basic concept of immunity. Now we will come to the hypersensitivity. So from the name, hypersensitivity means that is a exaggerated response. So an exaggerated immunogenic response after a prior dose of sensitization. Okay. So two things is very important. The response must be an exaggerated one. Okay. And the response, the final response must follow the prior sensitization, the previous sensitization with the said antigen. Okay. These two things are basic most, and these two things are must to be mentioned. So prior dose or sensitization dose is must, and the memory T cells are activated, and the next for the subsequent exposure with the same allergen, the body responds in an exaggerated manner, overwhelming manner. Okay. This is called hypersensitivity. Basic. So the injurious consequences in sensitized host following contact with the specific antigen. For induction of hypersensitivity reaction, the host should have contact with the antigen or allergen, must. Initial contact sensitizes the immune system, leading to the priming of the appropriate B or T lymphocyte. This is known as sensitizing or priming dose. So priming dose is very important. You know from your biochemistry knowledge, priming of RNA primers. So what does the priming or primer means? Rong korte hoy barite primer dite hoy age. So primer means the preparation of the next response or the better response. Okay. So priming dose or sensitization dose is must. Next, subsequent contact with the allergen causes manifestation of hypersensitivity as shocking dose. So priming dose, the cell are sensitized, the body recognizes, oh, this is this antigen. Okay. So after the initial exposure, the priming or sensitization occurs. There is a latent period, there is a window period. After certain time, after some period of period of idle nature, the next exposure of the allergen, the body responds in an overwhelming manner, an exaggerated manner. This is called as shocking dose. So this is the basic things of hypersensitivity. So next, so difference between immunity and hypersensitivity. So immunity is focusing on the neutralization of the antigen. Okay. So immunity is required for neutralization or nullifying the antigen, and hypersensitivity, it more concerned with the response of the host. So hypersensitivity is not required except for exams. Okay. So immunity is focusing the neutralization of the antigen, and hypersensitivity is more concerned with the response of the host to various type of antigen. The response of the host are diverse, few are cell mediated, few are IgE mediated, few are antigen antibody complex mediated, and fewer cell mediated. So there are 4 types: type 1, type 2, type 3 and type 4. Type 1 hypersensitivity is the atopy or allergy, is the main chief mediator is IgE, okay, that is the immunoglobulin E, with recruitment of mast cell degranulation, with recruitment of histamine, okay, serotonin, those are the vasoactive amines, they are released and they are responsible for type 1 hypersensitivity. So coming to the next slides. So must for hypersensitivity I told you earlier: contact with allergen, sensitization of priming dose, induction of antibody mediated immunity and cell mediated immunity, and next is shocking dose. The final countdown starts with the shocking dose. So allergy, it is a type 1 hypersensitivity originally used by the von Pirket, an altered state of reactivity to an antigen and included both types of immune response, protective as well as injurious. Also referred as all immune process harmful to the host, such as hypersensitivity and autoimmunity. So autoimmunity and hypersensitivity both are two spectrum. In hypersensitivity, the response is exaggerated, but it never target the host tissue as foreign antigen. But in autoimmunity, the antibody that are formed, they target the host tissue antigen as foreign antigen. Okay, commonly used as hypersensitivity. So classification of hypersensitivity reaction: immediate hypersensitivity and delayed hypersensitivity. So in immediate hypersensitivity, there are 3 types of hypersensitivity: class 1, class 2 and class 3. And delayed hypersensitivity, that is cell mediated hypersensitivity, that is type 4. Okay. So immediate hypersensitivity is B cell or antibody mediated. Our examples are anaphylaxis, atopy, antibody mediated cell damage like RBC cell membrane lysis or RBC lysis in hemolytic anemia. Arthur's phenomenon and serum sickness is antigen antibody complex deposition in body and subcutaneous tissue. Okay. Delayed hypersensitivity or T cell mediated infection or tuberculin type or contact dermatitis type, those are T cell mediated and those are delayed and broadly classified as type 4 hypersensitivity. So immediate hypersensitivity and delayed hypersensitivity, this kind of classification are now obsolete now, but immediate hypersensitivity encompasses the 3 types of hypersensitivity: class 1, class 2 and class 3, and delayed hypersensitivity is singly encompasses the type 4 hypersensitivity. Okay, clear? So immediate hypersensitivity and delayed hypersensitivity difference: appears and recedes rapidly, so sharp rise and sharp fall. Delayed hypersensitivity, from the name it called, appears slowly and lasts longer because it is active immunity and it is cell mediated immunity. The cell life of this immunity is long lasting, induced by an antigen or haptens by any route. But in delayed type of hypersensitivity, antigen or hapten intradermally, okay, or by skin contact. So it is skin contact dermatitis type or tuberculin type. Immediate hypersensitivity, the circulating antibodies present and responsible for the reaction. So this is an antibody mediated reaction. But in delayed hypersensitivity, the circulating antibody may be absent because there is active recruitment of the cytotoxic T cell and memory T cells. Okay. So this is a cell mediated reaction. Immediate hypersensitivity is antibody mediated reaction. Delayed hypersensitivity is cell mediated reaction. Passive transfer possible with serum, but here passive transfer is not possible with serum, but possible with lymphocytes or cell. Desensitization easy but short-lived, difficult but long-lasting. Desensitization means, that is, if we cut down or take back the allergen or the pollen or the thing or the allergen that is responsible for the atopy or the hypersensitivity reaction, if we take back those, the desensitization is easy. but short-lived. After reoccurrence of the antigen, it will appear again in terms of immediate type of hypersensitivity reaction. But desensitization is difficult in delayed type of hypersensitivity because the helper T cell or the memory T cell, they retain a memory. Those are long lasting. Okay? বুঝা গেছে? Concept clear হচ্ছে? So this is the main classification. Type 1 hypersensitivity, and it is coined by Coombs and Gale in year 1963. 4 types based on different mechanism of pathogenesis. Type 1 anaphylactic IgE mediated, type 2 cytotoxic or cell stimulating antibody mediated, type 3 immune complex or antigen antibody complex mediated, and type 4 is delayed or cell mediated hypersensitivity. So this is a schematic diagram of type 1, type 2, type 3 and type 4. Type 1, the pivotal role playing cells are immunoglobulin E, mast cell. Okay, mast cell have a ligand for immunoglobulin E. Whenever there is exposure of allergen, the immunoglobulin E, they attach with the mast cell surface, and as a result the mast cell degranule its contents by the mechanism of exocytosis. So release of the preformed vesicles and release of vasoactive amines like histamine, serotonin, etc. And those are responsible for vasodilatation, mucus secretion and bronchoconstriction each, like asthma. Okay, allergic rhinitis, urticaria, asthma, anaphylaxis, those are all type 1 hypersensitivity reaction, IgE mediated reaction, okay, with the function of vasoactive amines like histamine, serotonin, etc. Okay, and the basic cellular or vascular events are vasodilatation, mucus secretion, bronchoconstriction. So bronchoconstriction and mucus secretion, they are responsible for acute attack of asthma. Okay, everybody know the term asthma. What is bronchial asthma? Okay, that is type 1 hypersensitivity reaction. Next, type 2 hypersensitivity reaction is IgG mediated. Okay, antibody mediated, cytolytic or cytotoxic, I told you earlier. So the lysis of the cell occurs after the attachment of immunoglobulin to the cell surface. Okay, so and complements here also function as a chief assisting mechanism. Okay, you have a question in your internal assessment, role of complements, right? Role of complements, very few students have written the correct answer in that question. So the complement, the types of complement, the pathways and the byproducts of complements, how they opsonize opsonin, anaphylatoxin, these two terms are strikingly absent in most of you the students answer paper. Anaphylaxis, C3A, C5A, I told you, I taught you in this class, mediators of acute inflammation. Okay, opsonin, opsonization, very few students have written these two terms, opsonin and anaphylaxis. Okay, so here it is cytolytic or cytotoxic, and the examples are autoimmune hemolytic anemia, idiopathic thrombocytopenic purpura. So autoimmune hemolytic anemia, that is destruction of RBC, okay, and immune thrombocytopenic purpura means destruction of platelets. Okay, so immune hemolytic anemia and purpura are two classic examples of antibody mediated cell lysis or antibody mediated hypersensitivity, that is type 2 hypersensitivity. Next, type 3 hypersensitivity, the immune complex deposition, antigen binds with antibody and antigen and antibody complex are formed and they tends to deposit in subcutaneous tissues, vascular endothelium, various serosal surface, and various other organs, and this immune complex, that is the antigen antibody complex, they tends to obstruct the vascular lumen, or they tends to initiate the secondary infection after the deposition. So type 3 hypersensitivity reaction is antigen antibody complex deposition reaction, and the classic examples are Arthur's reaction, serum sickness, and SLE, systemic lupus erythematosus, that is immune complex mediated disease. Okay, so the culprit there is immune complex composed of antigen and antibody both. Okay, and next is type 4 hypersensitivity, cell mediated by release of cytokine damaged by cytotoxic T lymphocyte. Okay, contact dermatitis or tuberculin test or Mantoux test. Okay, very common. Liver damage due to drug allergy. So these are the basic cellular and vascular mechanisms of 4 types of hypersensitivity. Mast cell degranulation, I told you earlier, exocytosis, এই যে vesicles degranulation, vesicles থেকে preformed vesicles সব পড়ানো আছে, acute mediators of inflammation, mediators of acute inflammation, exocytosis হচ্ছে, ওকে, IgE এখানে সারফেসে লাগছে, অ্যান্টিজেন, এই যে অ্যালার্জেন or অ্যান্টিজেন, সো এটা টাইপ 1, সুন্দর ছবি, ওটা দেখতে সুবিধা, কনসেপ্ট একই। টাইপ 2 অ্যান্টিজেন অ্যান্টিবডি, IgG or IgM, hemolytic anemia. Type 3 immune complex mediated, serum sickness, SLE. Type 4 rash, contact dermatitis type, tuberculin test, SGS means Stevens-Johnson syndrome. Okay, very fatal. Stevens-Johnson syndrome due to any drug allergy, delayed hypersensitivity reaction, it is very fatal. Most patient, almost every patient, if developed SGS, unfortunately they dies. Okay, that is extreme kind of hypersensitivity, Stevens-Johnson syndrome, anaphylaxis, বাড়িতে চিংড়ি মাছ খেয়ে ফেলেছে, জানতো না, হট করে ব্রঙ্কোস্প্যাজম হয়ে গেছে, বাঁচানো যায়নি আর, তাহলে এগুলো হচ্ছে এক্সট্রিম কাইন্ড অফ হাইপারসেন্সিটিভিটি। অ্যালার্জি, নাক থেকে জল পড়ছে, চোখে লাল হয়ে গেছে, ধুলো লাগলো বাইক চালাতে গিয়ে, চোখে জল পড়ছে, these are milder forms of allergy, milder forms of hypersensitivity. Okay, now type 1 reaction or IgE dependent, the acute potentially fatal systemic form called anaphylaxis. So the systemic form, multi organ involvement, extreme form of type 1 hypersensitivity reaction, it is called anaphylaxis. The chronic or recurrent form, that is usually non-fatal. Most of us, they actually allergic to different kinds of individual, different kind of allergen. Some are allergic to foods, some are allergic to pollen, some are allergic to dust. Okay, these are generally non-fatal, typically localized form and called atopy, and short-lived and self-resolution. If we get back the noxious stimuli or allergen, it will go away. Okay, মাস্ক পরে গাড়ি চালাবো আর লাগবে না ধুলোবালি, অ্যালার্জি হবে না, অ্যাটোপি হবে না। সো টাইপ 1 হাইপারসেন্সিটিভিটি, এই যে রাইনাইটিস, ওকে, আর্ট্রিকেরিয়া, রানিং নোজ, these were type 1 hypersensitivity. And anaphylaxis is classical immediate hypersensitivity reaction. Ana means without, phylaxis means protection. The historical form termed by Riche, experiment on dog, also called Theobald-Schmidt phenomenon. So these are historical entity, not required for your exam. But anaphylaxis is the extreme form of type 1 hypersensitivity, and atopy is the milder form of type 1 hypersensitivity. So there are spectrum, 2 extreme. One is short-lived, non-fatal, chronic, that is atopy or allergy. Another is ultra short-lived, extremely fatal, and involve multiple organ, multiple whole systemic involvement, that is called anaphylaxis. So type 1 reaction involves itching of scalp and tongue, flushing of skin, difficulty in breathing in case of asthma, hypotension, loss of consciousness, death, rare. And treatment is adrenaline. Okay. So in anaphylaxis, multi-system involvement, itching, angioedema, conjunctivitis, laryngeal edema, and the patient generally die of the angioedema or laryngeal edema. The throat or the air passage is so much constricted, the patient don't get any air to thrive on. Okay. Many patients of anaphylaxis, they are first treated to secure airway by the means of tracheostomy, that you make a hole in your trachea and direct incorporate the exogenous air or oxygen infused air to the bronchi and lungs of the patient. Okay. So primary mediators are anaphylaxis, important vasoactive amine, histamine, okay, serotonin, and this is called vasodilatation, hyperemia, edema by increasing capillary permeability. All are hallmarks of acute inflammation, vasodilatation, okay, increased vascular permeability, secretion of histamine, etc. Serotonin, decarboxylation of tryptophan, smooth muscle contraction, increased capillary permeability, chemotactic factor, strongly chemotactic, eosinophil chemotactic factors, masks from the release from mast cell granules. So these are the cellular mediators of type 1 reaction. Atopy, I told you earlier what is atopy. Next, type 2 reaction, cytolytic and cytotoxic. So cell lysis occurs and toxicity to the cell occurs. Involve a combination of IgG antibodies with antigenic determinant on the surface of the cell, lysis of RBC by anti-RBC antibody, or leading to cytotoxic or cytolytic effect. So the antibody are directed against the cell surface antigen, and after the attachment of antibody to the cell surface antigen is destruction of the cell occurs itself, like immune hemolytic anemia, hemolytic disease of newborn, same thing, cell lysis or cytolysis. Type 3 hypersensitivity, Arthur's reaction, okay, serum sickness, এগুলো সব historical, এগুলো এখন আর হয় না, okay. এখন যখন ভাইরাস আমাদের এখন ভ্যাকসিন যখন দেয়, most vaccines are monovalent, okay. Initial the days of discovery, the most vaccines are polyvalent. Valency মানে কি? অনেকগুলো valency from the knowledge of chemistry, multiple attachment, multiple compatibility, okay. So if there is multiple attachment or multiple compatibility, there is a chance of more adverse reaction because the diverse recognition, okay. But whenever there is monovalent, that is more specific and that is more directed, that is not diverse, so more specific, targeted vaccine, monovalent vaccine, only one strain or one strain is involved, so that is more specific, more accurate, more precise, but strikingly the adverse reaction is also less. So Arthur's reaction, serum sickness, these are classical type 3 hypersensitivity reaction, are of historical importance, may not be asked in your exam. What is important? That is still important in today's life, that is type 3 hypersensitivity reaction, immunocomplex deposit reaction, that is SLE, systemic lupus erythematosus, okay. So systemic lupus erythematosus is a multiple organ or multiple system involving disease, okay, and the immune complex, they are deposited in vascular endothelium, causes vasculitis. Immune complex, they deposited in kidney, causing SLE, kidney damage, wall loop lesion, very important short question, frequently asked in your exam. Immune complex, antigen antibody complex deposited in the serosal membrane, pleuritis, serositis, okay, pancarditis in rheumatic arthritis, okay, or rheumatic fever, all are type 3 hypersensitivity. So immune complex deposition, those are not dissolved by complement, are hazardous for our own body. বোঝা গেল? এই যে Arthas reaction type 3, wheel and flare reaction type 1. Serum sickness, systemic form of type 3 hypersensitivity described by von Pirket 1905, অনেক বছর আগে. So clinical syndrome consists of fever, lymphadenopathy, splenomegaly, arthritis, glomerulonephritis, endocarditis, vasculitis, arterial rashes, abdominal pain, nausea and vomiting. So multiple organs are involved due to multiple location occurrence of the immune complex, okay. So immune complex, these are widespread and these are widely distributed in various parts of our body, and the response is systemic, response is widespread, and the clinical symptoms and signs are diverse in nature. বোঝা যাচ্ছে? Yes or no? Yes sir. Serum sickness, so vasculitis, this is a feature of vasculitis, okay. Purpura vasculitis, these are all result of immune complex deposition in subcutaneous tissue, okay, in the phalanges, subcutaneous tissue near the joint, okay. So the main culprit is immune complexes, antigen antibody complexes, those are not dissolved by the complement. So depletion of complement is important, is not sufficient to dissolve the antigen antibody complex or immune complex. Disease is self-limited. Single injection can serve both as sensitizing dose and the shocking dose. Immune complex occurs in many diseases including bacterial, viral, parasitic infection, disseminated malignancy and autoimmune conditions. So diverse form and multi-organ involvement. Next, the last is type 4 hypersensitivity or delayed hypersensitivity provoked by intracellular parasites or hapten reaction due to sensitized T cell. So I told you earlier, sensitization is important, and after sensitization of the host, the memory T cell, okay, the helper T cell, they comes in action in the first line, মানে ওরা open করছে innings. Helper T cells, okay, they process the antigen, they memorize it, and they store the antigenic structure for further reference, future references, the antigenic composition, the antigenic hierarchy, okay, those are being kept safely by the random access memory or RAM of the immune system, that is helper T cell, okay. Next, after the next exposure, the cytotoxic T cell, they come into action, ওরা middle order, and ওরাই innings শেষ করবে, ঠিক আছে। তাহলে পাওয়ার প্লে ওরা খেলবে। সাইটোটক্সিক টি সেল, সেল মিডিয়েটেড কিলিং, that is cytotoxic T cell. So the baton will be transferred from helper T cell to cytotoxic T cell for the lysis of the cell and bombardment of the cytokines, and final the shocking dose and the final countdown begins. Two types, tuberculin type and contact dermatitis type, okay. Tuberculin test, Mantu test এর কথা শুনেছিস তো তোরা? শুনেছিস তো Mantu test, that is contact dermatitis or tuberculin type, type 4 hypersensitivity reaction. Mantu test এর রিডিং আমরা কতদিন বাদে নিই? 72 আওয়ার্স বাদে নিই, ওকে। 72 আওয়ার্স বাদে নিচ্ছি, তার কারণ এটা ডিলেড হাইপারসেন্সিটিভিটি। যদি ইমিডিয়েট হতো তাহলে 3 মিনিট বাদেই নেওয়া যেত, আধ ঘন্টা বাদেই নেওয়া যেত, কিন্তু 3 দিন সময় দিচ্ছি। কেন সময় দিচ্ছি? যেই যে মেমোরিটা ছিল এগেনস্ট দ্য টিউবারকুলিন অ্যান্টিজেন, মেমোরি ক্যাপচার্ড বাই দ্য হেল্পার টি সেল, সেই হেল্পার টি সেলগুলো টাইম নেবে হচ্ছে সাইটোটক্সিক টি সেলকে রিক্রুট করতে, লোকালাইজড ওখানে এরাইদিমা ইন্ডিউরেশন প্রডিউস করতে, ওকে। সো tuberculin and contact dermatitis type, and main action mediated by cytotoxic T cell, action supported by helper T cell. Basic concept, don't forget to write down the basic, okay. Tuberculin type, এই যে intradermal এই যে দিয়েছি, ঠিক আছে, 42 to 72 hours বাদে দেখবো। Unsensitized individual, no response, but in sensitized individual that have a prior memory of past infection, okay, or previous exposure or family history, close contact with TB, those are sensitized individual. Those have response after 72 hours in form of, এটা কি বলে এটাকে, induration. So not only the redness is important for a positive response, induration is important. Induration means elevation from the surface, ফোলা। শুধু লাল হয়ে গেল একটা জিনিস, আমাকে টিউবারকুলিন টেস্ট দিল, নর্মাল ইন্ডিভিজুয়াল বা নর্মাল কাউকে দিলে যার নেগেটিভ হবে সবার লাল হয়ে যাবে। একটা বাইরের অ্যান্টিজেন একটা পিঁপড়ে কামড়ালে লাল হয়ে যায় তো সবার লাল হয়ে যায়, কিন্তু লালটা বেশি ফুলে কার যাবে, যে প্রিভিয়াসলি সেন্সিটাইজড। সো ইন্ডিউরেশন ইজ দ্য ইম্পর্টেন্ট, অ্যান্ড the circumferential diameter 10 millimeter into 10 millimeter, more than 10 into 10 millimeter is considered as positive, and the reading must be taken after 72 hours. Okay, contact dermatitis type, same thing, cell mediated. Okay, এই যে কন্ট্যাক্ট ডার্মাটাইটিস ব্লিস্টার হয়েছে, এটা কি হয়েছে? কন্ট্যাক্ট ডার্মাটাইটিস আমাদের হয় অনেক সময়, ছেলে বা মেয়েদের বেল্ট থেকে হয় তো, সব মেটাল বেল্ট সবার শ্যুট করে না, ওকে, তাই জন্য র্যাশেস হয়, সেটা কিন্তু ডিলেড টাইপ অফ হাইপার সেন্সিটিভিটি। ঠিক আছে, একই বেল্ট হয়তো অন্য কারোর কিছু করলো না, অন্য কোনো এফেক্ট করলো না, তার এরাইদিমা হলো না, তার ইন্ডিউরেশন হলো না, তার ইচিং হলো না, তার রিয়াকশন হলো না, তাহলে কি সেই বন্ধুকে বেল্টটা দিয়ে দিবি, নিজে অন্য বেল্ট কিনবি? সো দিস ইজ কন্ট্যাক্ট ডার্মাটাইটিস উইথ মেটাল। কন্ট্যাক্ট ডার্মাটাইটিস ইজ মোর কমন উইথ রিং, হয় অনেক সময় মাদের হয়, হ্যাঁ, বা পুরনো রিং হয়েছে বা রিং কেউ চেঞ্জ করেছে। সো কন্ট্যাক্ট ডার্মাটাইটিস হোক, টিউবারকুলিন টেস্ট হোক, দোজ আর সেল মিডিয়েটেড, দোজ আর ডিলেড, অ্যান্ড দোজ আর attributed by helper T cell first and cytotoxic T cell in final stage. So comparison of hypersensitivity, probably it is the last slide. So type 1 IgE mediated, type 2 IgG and IgM mediated, type 3 immune complex IgG IgM mediated, type 4 antibody none, তাই তো, no antibody, active component is cell. So here type 1 antigen and hypersensitivity, antigen is exogenous, antigen is on cell surface in type 2, type 3 antigen antibody is soluble intracellular in type 4. Response time short, very short response time, 15 to 30 minutes, minutes to hours, 3 to 8 hours, and type 4 is 48 to 72 hours or longer. Appearance ki hobe, wheal and flare, atopy, lysis and necrosis of the cell in type 2 reaction, type 3 erythema, edema, type 4 erythema and induration. Induration is important, okay. Examples ki ache, hay fever, asthma type 1, type 2 হচ্ছে pemphigus vulgaris, পরে স্কিনের যখন ক্লাস হবে তোদের পড়বি, অ্যান্টিবডি এগেইনস্ট দ্য কেরাটিনোসাইটস, ওকে, ইজ আ স্কিন ব্লিস্টারিং কন্ডিশন, অ্যান্টিবডি এগেইনস্ট দ্য কেরাটিনোসাইটস। গুড পাস্টুর সিনড্রোম, এটাও অ্যান্টিবডি মিডিয়েটেড, কিন্তু টাইপ 2 হাইপারসেনসিটিভিটি রিয়াকশন, এগুলো না মনে থাকলে অটোইমিউন হিমোলাইটিক অ্যানিমিয়া, আইটিপি, ইমিউন থ্রম্বোসাইটোপেনিক পারপুর, এগুলো বলবি, সোজা কথা বলবি, তাহলে এক্সামিনার তোকে সোজা কোশ্চেন করবে, ক্রস কোশ্চেন সোজা করবে। আর নিজে যদি শুরুতে একটা কঠিন একটা অ্যান্সার দিয়ে দিস, এক্সামিনার তোকে এত কঠিন করে বাকি কোশ্চেন জিজ্ঞেস করবে, কাঁদতে কাঁদতে হয়তো পরীক্ষা বেরোলি, সেটা করবি না। সোজা কোশ্চেন সোজাভাবে অ্যান্সার দিবি, সোজা এক্সাম্পল দিবি। টাইপ 3 ফার্মাল লাং, এসএলই, আর্থাস রিয়াকশন, সিরাম সিকনেস বলেছি অফ হিস্টোরিক্যাল ইম্পর্টেন্স, বাট ডোন্ট ফরগেট টু মেনশন অ্যাজ এক্সাম্পল অফ টাইপ 3 রিয়াকশন ইজ এসএলই, ওকে। টাইপ 4 ইজ টিবি টেস্ট, পয়জন আইভি, গ্র্যানিউলোমা। গ্র্যানিউলোমা লক্ষবার এসে গেছে, তোদের শর্ট নোট আবারও আসতে পারে। সো থ্যাংক ইউ ভেরি মাচ, অল ক্লিয়ার, ওকে।